What's up, everybody? We're going to do some wrist and finger mobility. We're going to start in passive range hold in wrist extension. Make sure there's no pain, and if 2 minutes is too long, you can do this for 30 seconds, a minute, 1 minute and a half, and then work your way up to 2 minutes. We're going to hold here and breathe diaphragmatically. Inhale for 4, exhale for 8. Really focusing on deep breathing and just relaxing in your passive range. In 20 seconds, we'll begin our PAILs contraction. Our PAILs contraction will start to press the fingertips into the ground, trying to flex the wrist. But since the ground is there, it's going to create an isometric contraction. We're going to move from 0 to 100% in 30 seconds. We're going to go ahead and start pressing in 3, 2, and 1, and start. Go ahead and start pressing those fingertips into the ground. 10%, 20%, 30%. Start using the entire body. Irradiate 40% to 50%, all the way to 60 to 70% effort, and then 70 to your safest and greatest effort for 10 seconds. Here we go. 9, 8, 7, using full body effort. Make sure it's safe. 4, 3, and now after 30 seconds, we're going to pull the wrist off the ground into extension. So trying to lift those fingertips off the ground for 15 seconds, going deeper into wrist extension. This is our rails contraction. Hold it for 5, 4, 3, 2, and then we're going to slowly go back to our passive hold. Breathe. Again, there should have been no pain. If there was any pain, you went too hard. And we're just trying to work within our own pain threshold. So from here, wrist flexion, this one might be a little bit more sensitive for people. So just remember that when we're in this position to be very gentle. Maybe the first time you do this is 10 seconds, and then you do it for 30 seconds, and then you do it for a minute and a half. Eventually, we're going to be able to hold for about 2 minutes passively. Finding a good, comfortable position to get yourself in so you're not putting too much pressure on the wrist and you're not putting yourself in any pain. There should be no pain throughout this. We're going to hold this. Inhale for 4, exhale for 8. In 20 seconds, we're going to begin pressing the back of the fingers, the fingertips, the nails, the knuckles into the ground, trying to deepen extension of the wrist. But since the ground is there, it's acting as a barrier. We're going to push into the ground from 0 to 100% effort as safe as possible here. So this might only be about 20% of your effort. So go from 5% to 10%, measure, assess, make sure it doesn't hurt. Go to your own 30%, your own 40%, your own 50%, your own 60%. Make sure that there's no pain here. Just push in as much as you can. From 50, do your safest and greatest effort for 10, 9, 8, 7, 6, 5, 4, 3, 2, and now we're going to pull those fingertips off the ground, go deeper into wrist flexion. You're almost trying to make a fist. Again, safe here. Do the safest and greatest effort that you can without hurting yourself. Hold it for 5, 4, 3, 2, and then we're going to go back to our passive range. Breathe. And we're going to set up for our next exercise. Now we're going to go into ulnar deviation of the wrist. So the wrist deviates in both the radial and ulnar angles. So when you're going toward the ulnar bone, as we are here, we're going toward the inside of the wrist here. That is the ulna side. And then the other side would be the radial side. So this is ulnar deviation. We're going to passively hold this position for about 2 minutes. Here we're doing it for about 1 minute and 45 seconds. We're going to inhale for 4, exhale for 8. From ulnar deviation in about 15 seconds, we're going to start trying to radial deviate. So we're going to try to go the other way. We're going to try to angle the wrist into the hand into the wrist. We're going to start pressing both of the hands together from 5% to 10% to 20%. Trying to get out of ulnar deviation. You're trying to deviate the opposite way, pressing into the hand, 30% to 40%. All the way to 50% to 60% of your safest and greatest effort, as much as you can here for 10, 8, 7, 6, 5, 4, 3, 2. Now we're going to try to lift away from the hand, going deeper into ulnar deviation. So if your hand moves away, that's fine, or you can just leave it where it is. You're trying to go deeper into ulnar deviation for 5 more seconds. 4, 3, 2, and 1, and done. So that would be PAILs and rails for ulnar deviation. Now we're going to go for radial deviation. So that's the thumb going toward the wrist. Okay, that is the radial side of the wrist and elbow, and that is where we also take our pulse, right underneath the thumb. So we're bending into that area laterally here. So that's our radial deviation, and we're going to hold here for, again, 2 minutes. Inhale for 4, exhale for 8, 1 minute 45, and just focus on your breathing. Our PAILs coming up will be pressing that hand into the wrist and wrist into the hand, and you're trying to deviate the opposite way. So you're trying to go from radial deviation to ulnar deviation, but you can't because the hand is there. Start pressing into each other here. 10%, 20%, 30%, 40, 50, 60%, and hold. Keep pressing here, and then you're going to go to your safest and greatest effort, and we're going to hold it for 10 seconds. 9, 8, 7, 6, 5, 4, and then get ready. We're going to try to pull away when we go to our rails contraction. We're going to go deeper into radial deviation, holding it for 15 seconds, lifting it away from the barrier. Hold here. Keep going in. Yep. 3, 2, and 1. And go back to your passive range. Breathe. And then we're going to perform some wrist cars or wrist circles here, nice and controlled. Control the articular rotations of the wrist. And just notice the hands and the fingers here. The last thing we'll do is quickly go over finger-controlled articular rotations. You can do one rotation of the thumb, the pointer finger, middle finger, index, and pinky. And so you can also perform finger cars. You can do this especially with our thumbs, as we like to use our phones. It's really important to work your fingers out as well and try to balance the dysfunction that we've created. Thanks a lot, everybody.